Welcome to the fifth episode of the series Speeding Toward a Recession. Today we're diving deeper into the potential fallout to our economy from the significant cuts to Medicaid and SNAP. Even if you've never used either program, the economic consequences of these cuts can touch your life. This is about understanding the interconnectedness of our systems. When we pull on one thread, the entire fabric can unravel. Cuts to the program that seems distant can trigger a cascade of layoffs, business closures, and rising costs that ultimately affect every household. These aren't just safety nets for individuals, they are crucial economic lifelines that support entire industries and communities. When these lifelines are cut, a series of unseen dominoes begin to fall, threatening jobs, essential services, and ultimately our collective economic stability. If you're interested in learning about all the dominoes that are in place for a recession, please consider subscribing to hear more. Let's start with Medicaid. This program provides health care coverage for over 80 million Americans. That's roughly 1 in 4 people in the United States, including low income families, children, pregnant women, the elderly, and people with disabilities. For many hospitals, especially those in rural areas or serving vulnerable populations, Medicaid payments represent a substantial portion of their revenue. Imagine a hospital where 30 to 50% of its patients' revenue comes from Medicaid. Now imagine significant cuts to that funding. Hospitals are forced to absorb higher costs for uncompensated care provided to patients who just cannot pay. This isn't charity, it's a financial burden that can quickly become unsustainable. Since 2010, over 150 rural hospitals have closed across the country, often in communities where they are the largest employer and the only source of emergency care. Further Medicaid cuts would accelerate this trend dramatically. When a hospital closes, it's not just the healthcare access that vanishes, it's hundreds of jobs that disappear from the local economy, like doctors, nurses, administrative staff, maintenance, and janitorial services. It means more people in emergency room, driving up costs for everyone. It also means increasing wait times, and it means critical services like maternity wards or trauma centers become scarce. It also means a longer drive for emergency squads to get patients to the closest hospital. This isn't just a healthcare problem, it's a massive job loss and economic destabilization event for entire towns. Next, let's talk about food stamps, officially known as Supplemental Nutritional Assistance Program, or SNAP. This program helps over 40 million Americans put food on the table. But SNAP isn't just about feeding families, it's a powerful economic stimulus. Studies have shown that for every dollar in SNAP benefits, it generates up to $1.80 in economic activity. This occurs because that money is spent immediately, directly supporting grocery stores, farmers, and the entire food supply chain. For many small independent grocery stores, particularly those in underserved urban or rural areas, SNAP benefits can account to 30 to 50% or more of their total sales. These are often the only sources of fresh, healthy food in their communities. If SNAP benefits are significantly reduced, millions of families will have less money to spend on groceries. This directly translates to a massive drop in revenue for these stores. Many small grocers operate on thin margins. A substantial dip in sales can push them over the edge, leading to closures. When a small grocery store closes, it creates what's known as a food desert, forcing residents to travel further, pay more, or rely on less healthy options. And just like hospitals, these stores employ local people, cashiers, stockers, managers. Their closure means more job losses and a further erosion of local economic vitality. Now, let's look at a sector that often operates quietly but is profoundly impacted by those cuts: nursing homes. These facilities provide essential care for our elderly and most vulnerable citizens. A staggering 60 to 70% of nursing home residents rely on Medicaid to cover the cost of their long term care. To put the financial strain into perspective, the national median cost of nursing home care is substantial. For a semi private room, the median cost is around $9,277 per month, while a private room can average about $10,646 per month. These figures highlight the immense financial burden on individuals and families seeking long term care, making programs like Medicaid absolutely critical for access. If Medicaid funding is cut, nursing homes face an immediate and severe financial crisis. Reduced Medicaid payments means a loss of 60 to 70% of their residents. This can lead to a decline in the quality of care and eventually to closures, and means thousands of elderly and disabled individuals lose their homes and their care. It puts immense pressure on families who may not be equipped to provide the necessary level of care and on an already overburdened healthcare system. We're talking about potentially hundreds of thousands of job losses across the healthcare, retail, and long term care sectors. When people lose jobs, they spend less, further slowing the economy. This impacts local businesses from restaurants to auto mechanics, creating a domino effect of economic tightening. The closure of hospitals, grocery stores, and nursing homes creates critical gaps in essential services. Imagine living in a town with no emergency room, no access to fresh food, or no local option for elder care. This degrades the quality of life for everyone, regardless of income. As we continue speeding toward a recession, it's critical to consider how these unseen dominoes, once set in motion, can accelerate our journey towards economic instability. Please subscribe, like, and share. It will help my channel continue to deliver timely material that matters. Join us next time as we explore the impending results of the tariffs, another domino in the road to a recession. Thank you very much.